because today's webinar will demonstrate a deep understanding of our role as medical lab officers, and it will elevate us by improving our efficiency, our competence, and our excellent turnaround time in the practice in our day-to-day routine laboratories, research laboratories, and even in our learning institutions. Thank you so much, members who are still coming in. Thank you. Our numbers are getting better, and soon we are going to start this particular presentation. It is also important to do emphasis on our CPD upload system via the KMLTTB portal. And it is important that for us to successfully upload your CPDs, it is important that you sign in to the KMLTTB portal and make sure that you have a current practicing license. And you also ensure that once you have signed in and you are legally active on that portal, then you need to also register on our webinars and ensure that your participation is more than 60% in terms of attendance. And also ensure that when registering, your details are counter-checked. Ensure that your name, your email, your license number, and your ID number are correct. Failure to this might lead to your points not being uploaded. And therefore, it is important that you make sure that such kind of criteria is adhered to. It's also important to note that that payments for webinar is not transferable, and therefore, whenever you pay for any webinar, it is important that you ensure you attend that particular webinar. However, for learning purposes, you can access our recorded versions that we always share after every webinar. You can also join and tune into our YouTube channel so that you're able to also learn. Thank you so much. Now, I think because our numbers have increased, and so we are ready and able to continue with the presentation, I will invite our presenter for today. Remember, our topic for today is advancing stool parasite diagnosis through improved diagnostic methods. And our speaker will be Mr. Hosea M. Orango, who is the holder of a master's degree and a bachelor's degree in medical lab sciences. And he is also a principal lab analyst at Cambridge, CIPDCR, particularly Busia branch. And therefore, he is coming to us with a vast knowledge on matters stool diagnostics. Today, he'll be able to also tell us much about the methods that we can use to significantly advance the stool parasite diagnosis, so that we are in the process, we are able to enhance both accuracy and efficiency. So thank you, our members, for coming in. And for now, allow me to welcome our presenter, who will take it away and continue the presentation. I hope you're able to hear me, Mr. Hosea.
Yes, I can hear you, sir.
Thank you so much. Yeah, thank you so much. We are happy to have you, and kindly take it away. Proceed.
Thank you. Good afternoon, ladies and gentlemen. Welcome to this live webinar My name, as you have heard, is Jose Morocco from Cambridge, Center for Infectious and Parasitic Diseases Control Research. I'm actually honored to host you today, and I'm glad you've chosen Laboratory Medicine Society of Kenya as part of your CBD provider. I'm looking forward for a session of knowledge sharing and scientific engagement. So colleagues, as you are aware, direct methods, we sometimes call them traditional methods, have long been used for stool parasite diagnosis. And while we always value them, they have some limitations in terms of sensitivity and consistency. So today, I'll bring to your attention a set of simple and affordable, accurate techniques that we can use to improve our diagnostic outcomes and ultimately
Hello,
enhance patient.
Mr. Hosea. Mr. Hosea,
Yes,
yeah,
yep.
kindly, your slides are not moving. Are you able to move your slides? On our side, we
Yes,
are not
yes,
able to
yes,
see your
yes,
slides.
yes, I'll
Slides,
move. I'll
yes.
move.
Okay.
Okay, okay,
And then your speed is a bit high. Can you moderate the speed, please?
okay, okay.
Yes, thank you.
Okay. Colleagues, our topic for today is advancing stool parasite diagnosis through improved diagnostic methods. Let me give you an overview of our main objectives for today. So the first objective we need to look at is to refresh our understanding of the most improved parasite diagnostic methods with increased accuracy. The second one is to ensure quality assurance throughout our processes, that is pre-analytical, analytical, and post-analytical. Another one is going to assist us in our role that we play in control arm fight of neglected tropical diseases by enhancing correct and early stool parasite detection and therefore timely treatment. And the last objective will enable us as lab officers to improve our competency and of course produce accurate and precise results that enhance patient care and positive influence on public health. The rationale for this topic of today is accurate and improved stool parasite diagnosis is always key in controlling intestinal parasitic infections and positive public health outcomes. And therefore, adopting these techniques that are widely accepted as standards for stool diagnostic methods will therefore not only strengthen our research, but always also improve our patient care and contribute to universal health coverage. And this always aligns with global efforts of eliminating neglected tropical diseases, especially those ones caused by intestinal parasitic infections, and also supports sustainable development goals. This is goal number 3 and 6 that is geared towards health equity and disease prevention in underserved populations. So goal number 6 is about clean water and sanitation, and goal number 3 is about good health and well-being. So let me take you through quality assurance in intestinal stool parasitology before we look at the methods. So, and before that, I want you to think about this logically. One, could you trust the results from a poorly maintained microscope, for example? And number 2, is a poorly written report only less damaging than a poorly developed or done test? Think about that one. So number 1, we need to look at collection and transport of specimens. So we always require that our containers be free of traces of disinfectants. They must be clean and dry and always leak-proof. When we talk of disinfectants, I mean, you might have cleaned your containers using sometimes jig, 1% jig. You make sure they are free from those, they are dry and clean always from those disinfectants. Number 2, we always collect specimens at the correct time. We encourage morning specimens for our routine testing. Number 3, we always ensure that our QC is taken care of in terms of ID on the specimen container, the date and time of collection, and always make sure that you've matched the information from the request form or patient booklet with that information on the container so that you can avoid mismatches. Then another one is process these specimens as fast as possible. We need to process them between 30 minutes and 1 hour so that we can avoid losing some of the morphology. And of course, we're going to see in the next slide, sorry, that in case you cannot process immediately, then you might have preferable preservatives that you can use to keep your specimens for some time until you do analysis. Always advise the patients on the right procedure. Of collecting these specimens. We are going to see shortly on how we can advise them to collect the specimens. In case you want to use a preservative, you do it when specimens are to be sent to a reference laboratory. Maybe you are not able to do that particular test, or you cannot use that method in your peripheral lab. You want to refer a specimens to a reference lab. You can use a preservative. Or you are receiving a specimen from a reference lab in form of as part of quality assessment program, then the reference lab needs to send a specimen while in a preservative to a peripheral lab for assessment. Or you want to preserve your specimens for teaching purposes, then you have to use a preservative. Or sometimes when specimens are collected in the field for some surveys and you need to collect and transport them to the laboratory for testing, then we are encouraged to use preservatives in that case. Something to note is that for long-term preservation, sometimes we do make instant slides that have some seeds and eggs for future use or teaching purposes. Then you can mix your specimen with glycerol and alcohol in a ratio that I'm going to give you down there, and you mount for future purposes. This one comes as a permanent slide. Another QC, another quality assurance thing that you need to look at is how you use your equipment. We always encourage that first, you should know the equipment that you need to use it when you undertake your experiments. You have various equipments that you can use, colleagues. You can use a microscope, you can use a centrifuge. Some experiments require that we use an autoclave to autoclave some other things before we do analysis. Sometimes you need a water bath, sometimes you need a weigh balance, you need an incubator. So all these equipments must be you must be very conversant on how to use these equipments. You must ensure that they are all calibrated before you use. Especially when we're using a microscope, which is our daily equipment. Some people prefer using it, calibrating it annually, and some prefer calibrating it annually. It depends on the workload on your microscope. Most of the programs, especially research programs, we do calibration after every 6 months. But for a setup like for routine testing, if the resources are not available, still you can do it annually. And we have the daily maintenance that we do. You check the objectives, you check the condenser, you check the diaphragm, all those things that are okay. You make sure there is no dust around the microscope. You make sure there is no oil immersion left when you are keeping your microscope. Those are daily maintenance, routine maintenance activities. And when you want to use a microscope, for example, we always encourage people to start with times 10 before times 40 when doing stool examination. So the essence of using times 10 first is that times 10 gives us a very wide range of fields that we can examine than times 40. So for preliminary, for quick analysis, start with times 10 so that you can get a wide field, many fields at a go, and you can also see some features for preliminary analysis before you advance to times 40 to see some morphological features that you might have missed in times 10, like the internal structures. For example, when it comes to trozoids, when it comes to cysts. For another machine that we normally use, another equipment is a centrifuge. So when it's centrifuging samples for stool parasitology, always make sure that you use a low speed. We encourage people to use a speed of between 1,000 to 1,500 maximum. Those are revolutions per minute. Some people prefer using centrifugal forces. So always remember that 1 G equals to 1.6 revolutions per minute. So you can always divide this one over 1.6 to get how many Gs you need to set. If in case you have a centrifuge that is calibrated by using Gs, not revolutions per minute. So we always use low speed so that we can keep the morphology of some of the stages that we need to examine. Let's look at the reagents and stains. Always check that your reagents are not contaminated. Make sure they are quality, they are not expired. Prepare them in the right ratio. For example, you want to prepare glucose iodine. If you use glucose iodine for a direct method in a setup like a sub-county hospital where you cannot do indirect techniques, then make sure you use the right ratio. If you are using glucose iodine, the ratio will prefer 1 to 5 or 1 to 10. But actually, you can purchase Dobel's iodine that is directly from the manufacturer and it's already diluted. It's between 0.5 to 1%. And we prefer that one when it comes to stool parasitology. Avoid contaminating reagents when you are using droppers and squeeze bottles. So if your experiment needs that you must use a squeeze bottle or a dropper, make sure that you don't contaminate that container with a specimen, because you have many samples to use, and we prefer preparing the reagents maybe after 1 week or after 2 weeks. So if you contaminate today, then it means tomorrow you might be having some positives that you are carried out from today to tomorrow. Keep our reagents in the right conditions. For example, if you are using Dobel's iodine, it's supposed to be in a dark brown bottle, and we always cover. You can always cover. If you don't have a dark brown bottle, you can cover with some light opaque paper so that it's away from light, because light degrades some the working activity of this reagent. Number 4, performance of the technique is one of the things we look at when it comes to quality assurance. Define your method of use and adopt it. People always have their quick notes that they make in a lab for specimen analysis. Always refer to your method that you have adopted, and make sure that you use your method consistently. Always prepare appropriate SOPs. You can have an MSDS from a specimen container, from a reagent, and you can make quick notes from your reagent in terms of preparation and when to use it. So you can have your appropriate SOPs that are aligned to the experiment you want to undertake. Always prepare quick bench aids instructions for quick use, and we always encourage that you use the latest edition of bench aids and ensure that you follow them by all staff members. When it comes to detection and recognition of parasites, we always encourage that we do adequate training to all staff members or interns, and always supervise and train newly qualified staff and make sure that they understand the procedures and they sign somewhere that they have understood about the training. Give them some quick practicals so that you can see their competency. Ensure that specimens are examined for sufficient length of time. So when it comes to stool analysis, even if you are using direct method or indirect methods, we always advocate that you examine between 10 and 30 minutes, maximum 30 minutes. You have examined and gotten the parasites that you are looking for. Display charts that have different stages of these parasites. Use bench aids, some artwork to show identifying features of parasites. We have features, different features. You can see trovozoids, you can see seeds, you can see ova, you can see larviforms. You know, all those, make sure you have some display charts so that you can use them to assist members of staff to always follow and compare those features. Appropriate use of equipment is encouraged. When you use a microscope, make sure you know how to use a microscope. When you're using low power objective, make sure the position of the condenser and the diaphragm at the same time. And when using a centrifuge, make sure that they always say that on the bench, we don't put a microscope and a centrifuge on the same bench. Make sure that they are separated because of the force, the centrifugal forces and the speed of a centrifuge. Sometimes when it's shaking and someone is examining on a microscope, it keeps on disturbing them when they get a feel and they want to focus. So make sure you separate these two equipments. And during examination, and you see some less commonly seen parasites, make sure that you preserve them or make some permanent slides for future references. Always do provisions testing to all staff members. Sometimes, if possible, if you can afford, you can enroll your laboratories to EQA schemes. You have different EQA schemes within counties and the national programs. So if the county government can afford some EQA, to enroll you on EQA schemes, always encourage them that you can have even 2, 3 or 4 tests enrolled on EQA so that you can always measure your competence. Repeat tests to refer to a reference lab when results are unclear. So you are trying to look at the slide and you realize that you are unable to determine the stage or what you are actually seeing. And you've consulted your supervisor is also unable to do that one. You can refer that sample to another lab so that you can get clear results. Use concentration techniques and examine multiple slides when it comes to low burden infections. Some infections like schistosomiasis, you don't get several over in a single stool sample. You need to examine multiple stool samples so that you can harvest more. And sometimes you might miss, and actually the symptoms are directly related to schistosomiasis. So you can do concentration techniques or you can do multiple samples so that you can not miss an infection. Always adhere to SOPs, apply internal controls to monitor lab consistency. So that's why we say when you get an interesting sample, a positive interesting sample, always keep some of these over and cyst. Or if you see a parasite that it's very interesting, you always preserve and use it for your internal controls or for future references. On reporting and recording of results, always use a standard format. In our lab, you come up with your standard format. It might not be the same as another county, but make sure that you standardize your reporting formats and ensure they are always clear and neatly written. Use abbreviations that can be understood by report recipients. These are nurses, medical doctors, clinic officers, whoever who requested for a test should be able to understand the abbreviations that you used. Always all reports must be checked and verified by a senior staff member. So always consult. You can't be the final person to release the results. You always say that someone has to confirm. Your immediate colleague or your supervisor needs to confirm and verify this before you release results. Keep accurate records for all investigations and for traceability and audits. Now let me take you through stool sample collection, acceptance, and rejection guidelines. So when it comes to collection, give the correct instructions to clients accordingly by using a simple language. When you say, go and bring me a stool sample, they might not understand. This is a medical terminology. Just say, we need tunataka hacha kubwa ama hacha ndogo. You specify. Sometimes when you say, tunataka choo, someone brings you urine because they know that urine goes to the toilet and stool as well goes to the toilet. So someone can bring you a specimen that you did not request for because you used the wrong language. Always make sure that our containers are leak-proof, very clean, and you label them accordingly. Instruct patients to put their samples on a clean bedpan or a plastic wrap or a tissue paper over the toilet before they collect. Because if you don't advise on this, someone can put on the floor, especially when you're using bit latrines. Then they take a smear using that scoop, and they actually smear a sample from the first patient who used the toilet. So always instruct them. If you are giving them a tissue paper, give them a little bit a bigger size so that they can use a small portion, a small size of the tissue to put it on the surface and they defecate on that tissue paper, a small portion before they pick and collect into a container. For infants, you can always advise their caretakers or their mothers to line the diaper with some clean plastic wrap or a diaper liner so that you can avoid stool absorption into the diaper. Then let them scoop 5 to 10 grams of stool into the container. So sometimes they might not scoop if it's watery, so you advise accordingly. And when we say 5 to 10 grams, it means that size, the scoop that you see in a stool collection container takes exactly 2 grams of stool sample. So if you wanted 5, they can take 2.5. And if you wanted 10 grams, they can take 5 of them. So if they take 5 scoops of that from that scoop that is in that container, that is equivalent to 10 grams. Advice on no contamination with urine, stool, sticks, water, tissue paper they were using, etc. Always encourage that we collect fresh samples within 30 and 60 minutes. If the sample was collected yesterday and the patient has reported today, they say that they have a sample that they collected yesterday, that one must be rejected because that's an old sample. Provide multiple samples over 2 to 3 days if required. In some research studies, we require that they collect a sample on a Monday, Tuesday, or a Wednesday, Thursday, Friday, at least for 3 consecutive days so that we can harvest many parasites as possible, so that we don't miss parasites, especially when there was a low burden. Acceptance criterion. So how do we accept the samples? When they bring the samples, always make sure that you check the integrity of the container. Make sure they use the right container. They don't use a container from the match boxes. They don't use plastic bags to collect the specimens. And they tell you that already I have a specimen here. Just give me your container. I exchange. I put inside there. No, we must make sure that they use the correct containers. Confirm the labeling if it's accurate. Always match. Confirm again if the information on the request form is same as the information on that container. Record date and time of reception in a register. And if you are digital, you can use a laboratory information management system, put in your details. But make sure you always register all the samples when they are received. Assign lab number and log the sample. the essence of recording date and time, especially for routine diagnosis. So some patients can just say that I came here very early in the morning and it's 5 hours, I've not received my results. Only to realize that when you gave them a container, they went and waited until they can get a stool sample for around 3 hours. So for them, they started counting when they were received in the lab and when a container was given to them. So always make sure that we be strict on the time a sample was received so that we can easily calculate our turnaround time. How do we reject samples before we do analysis? If they are in an improper container, matchbox, plastic bags, protein, etc., always reject. If they are unlabeled or mismatched, always reject. Dried or desiccated stool samples, always reject. Contaminated with urine, water, soil, sticks, always reject. Delayed transportation, no preservative, it was collected yesterday, they want to bring it today, you have to reject. Or it was collected in the field and they forgot to put in a preservative before they bring for analysis, always reject. And if the sample is always insufficient, they just make a smear, someone smeared on their container, then they expect you to run at least we need 0.5 grams of a stool sample. A quarter, that scoop is what we require at least. If it's not enough, always reject. And a note to make is that do not use formalin or a fridge for samples that if you are doing culture for hookworm, Slongodes stachylaris, and Amoeba histolytica, or hatching techniques for schistosoma species, we always want a sample that's less than 30 minutes, or we don't use preservative, we don't put in a fridge. Now, these are some of the preservatives that you can use in a lab. So 10% formalin is quite often used. Make sure you prepare in the right ratio. It can preserve eggs, cysts, and larvae, but it's very poor for trovozoites. So if you wanted to preserve trovozoites, then you go for polyvinyl alcohol, which can preserve trovozoites for some time. It will maintain the morphology. If you use 10% formalin, the morphology of these trovozoites is distorted. You won't see them during examination. Otherwise, we encourage people to immediately examine a stool sample if you are suspecting that there might be trovozoites in that sample from Sarcodinas, that's in the Amoeba histolytica, from Ciliophorus, that is Plantidium coli, from Mastigophorus, that is G. lamblia. Always make sure that you examine immediately if you are suspecting there are trovozoites, especially when the stool is very, very watery. There's a likelihood of you harvesting a lot of trovozoites in that sample. So in a setup, you don't afford formalin, then you have alcohol. You can use 70% alcohol for all the stages, although it's not ideal for long-term storage. Otherwise, in some settings that you don't have money, you can always use Bayer's solution, which is an alternative to formalin. Now, if you reject a sample, before we go to the next slide, make sure that you inform the patient and the clinicians in case you rejected a sample. Make sure you inform them. Tell the patient you have rejected a sample because of ABCD. You are required to collect another sample. Inform the clinician in time. They were expecting for results after 1 hour, and they are now waiting for 2 hours without results. Make sure you inform them that you rejected a sample and you requested for another one. Guide on a proper collection procedure, again, the patient so that they can bring up the right sample. Provide timely feedback on urgent findings. And if there is a delay, then you can use a preservative, as we said, except for culture techniques on those particular parasites I mentioned. So this is what you are familiar with, of course. I want to take you through briefly on microscopic examination. I want to assume that from the presentation we had 2.5 weeks ago, you got the macroscopic examinations that we do in terms of consistency, color, etc., etc. I want to go through that one. So I want to go direct to the examination, microscopic examination. So a brief on wet preparations that we normally use. Yes, we advocate for these methods, but they have some limitations that we can always avoid. So for direct methods, always remember that we're using 0.85% sodium chloride, or we are using 0.5 to 1% Dobel's iodine. So for a quick one, when you are doing a direct method, make sure that when you have accepted a sample, you have already prepared 0.85% sodium chloride, which is prepared in the right ratio, because if you under dilute, it will distort these parasites, they shrink, they crenate, and if you over dilute the samples, the reagent, then your specimens, your parasites are going to lyse, and you will miss them during examination. So make sure that you are using the right ratio and the right percentage. So for a quick one, you take around 0.5 to 1 grams of your stool sample, and you can add equal or double amount of normal saline for emulsification. So we encourage that you can use it in that container. So you can divide a small portion within that container, and you add your you add some equal or a double amount of normal saline to around 0.5 to 1 gram. So when I say 1 gram, I mean half of that scoop is equivalent to 1 gram, so that you can emulsify and put a fine drop on a slide and examine. So when you're examining, we always say that you have to examine. You can use a dropper, you can use applicator stick, whichever you want to use, but make sure you put a fine drop on a slide in the cover slip. If you introduce particles on that drop, then your cover slip is not going to be uniform. Your smear is not going to be uniform. Ensure that you put a fine drop before you cover slip and examine. Always start with times 10 or times 40. This is just a demonstration of a comparison between G lamblia. This far end here, this is G lamblia horizontal view, and this is a vertical view, and then this is a cyst of G lamblia. So we try to compare. Sometimes people confuse Gelomatrix mensili and G lamblia. So the difference is you see a trophozoite of mensili as 3 flagella, and unlike G lamblia, which has 4 pairs. When you look at G lamblia, it has some sucking disc with 2 nucleus. When you look at mensili, it has just a nucleus. There are no sucking discs. When you look at G lamblia, it has an axonium body with some medial bodies. Some people call them paraparsal bodies, which lack in Gelomatrix mensili. Same to the nucleus, it has one. For mensili, you see just 1 nucleus there. And looking at this one for G lambda, it has 4 nucleus with some axonium body that divides the nucleus into half each. Of course, the cell wall for G lambda is very thick compared to the cell wall for mensili. So sometimes you can use Dobel's iodine to increase contrast and examine the internal structures of some of these cysts. But remember, for iodine, you can't use iodine to examine trophozoites. So if you were to take for trophozoites, make sure that you use normal saline from this first experiment here. So iodine is going to help us examine cysts and make a distinction between cysts from different classes. We have cysts from sarcodinas, cysts from mastigophorus, and cysts from xylophorus. So before you add iodine, you might confuse, for example, a cyst of G lamblia and a cyst of Blanchidium choline. When you add iodine, what it does, it colors the internal structures, and you can be able to make a distinction. But the procedure is the same. You just put a fine drop, you add a drop of iodine, cover slip, and examine. So this is just a demonstration of intermoeba species, both trophozoites and cysts. So you realize histolytic and dispar are the same, and Microscopic. So until you do some PCR identification, you might not be able to distinguish these. We have some species like Hartmanni, which is a mini version of histolytica. This is easy for you to distinguish under a microscope during direct wet prep or whichever method you use, because it has 2 nucleus and the histolytic has 4 nucleus inside. This one is very small, the histolytic is a bit large. And when it comes to examination of trophozoites, you realize that it's only histolytic that can have ingested red blood cells, but all other species lack red blood cells. You get that they have ingested yeast cells and sometimes bacteria, except trophozoites for for E. ingivalis or Tinax, which have ingested white blood cells, not red blood cells, not bacteria, not yeast. This is just a further demonstration of how you can make a distinction between some of these. You see, the far end here, this is on your right, on your left far end, that is T vaginalis. Sometimes we might have contamination of these samples and you never realize. And you see some trophozoites in a stool sample, and you see this is not resembling T hominis. It can be a contamination from T vaginalis. So you can make a distinction between T vaginalis and hominis by looking at their structures. If you examine clearly, the undulating membrane for T vaginalis is half the body length, while the other one for T hominis is full the body length. T. hominis has a trailing flagella extending beyond the body, which lacks in T. vaginalis. T. vaginalis has some posterior axis style. You look at something like the tail, which lacks in T. hominis. And of course, we have some granules along axostyle, very common in T. vaginalis. You see some dots like granules along the axostyle, which lack in T. hominis. Then on your right far end, this is Balantidium coli, which is very clear. Balantidium coli normally has micronucleus and macronucleus. So, for example, you are examining a cyst and you add iodine, you will clearly see the difference between Balantidium coli and E. stolytica and G. lamblia. Of course, for trovozoids, they use flagella for locomotion. These other ones, for Mastixophorus, they are always using flagella for locomotion. This one using cilia, sorry. Balantidium coli is using cilia for locomotion, while Histolytica uses a pseudopodium. You see some contracting vacuole. Due to mitochondria in that vacuole, you see it projecting something like legs, which are not legs actually. That's why we say that pseudopodia. Look at Balantidium coli, you will see cilia, very clear that it's moving around using cilia. And for G. lamblia, you see it moving using flagella. So let me introduce you to improved diagnostic techniques that we can actually use in our setups because they are very simple, they are very cheap. They don't need a lot of time. Within 30 minutes, you have given your result. We can actually do these ones in our sub-county hospitals, in our health centers, in our county hospitals. I expect sub-county hospitals and county hospitals to be doing this. It's only health centers that we can allow to do a direct method because they are very cheap to do. So then now I can just ask yourself, how many times have you used a direct method during a stool sample diagnosis only to miss out what was actually present? Or are we truly giving our patients the best when it comes to stool diagnosis when we are depending only on direct method? Colleagues, we are able to do these methods in our setups. It's only that we have some people just ignore that this is a very expensive method. This is a tedious method. No, they are not tedious. They are very cheap. We are going to see some of the concentration methods like sedimentation that do not require electricity. So you don't need to have a centrifuge. You only need a microscope. And if you don't have electricity and you have a light microscope, you can always use these methods to do your techniques. So for improved diagnostic techniques, I'm going to tackle around 3 for today. So the first one is stool concentration techniques. So concentration techniques are methods that we can use because of these reasons. You can use them when you want to confirm absence of parasites from direct method, but you actually see that the symptoms are suggestive of a parasitic infection. You did a direct method, you miss them, and you always think that there must be a parasite in this stool sample. You can do these techniques. Number 2, you can use them to detect eggs of parasites, which are often very few in number in our stool samples. For example, Schistosoma species. In our stool sample, you might even see less than 10 over from Schistosoma species. And sometimes Tinea species are all very few in number in our stool samples. And you did a direct method. You always miss them and you report false negatives. You can advance to these methods and actually capture these parasites. You can also do this to confirm whether treatment has been successful. So you did a survey, you realized there is an infection in some locality, you gave anti-dewormers, and you want to confirm if they actually worked. You can do these methods to confirm if that was successful. You can do indirect methods or concentration techniques to investigate the prevalence of a parasitic infection in some area. So when you're doing epidemiological surveys, always make sure that under your methodologies, you include these methods. Don't only rely on direct methods. You might miss the parasites. And you also use these methods, especially sedimentation methods, to clear or separate fecal debris and background materials. And this improves visibility under a microscope. We're going to see how they do clear these stool samples. So the first one, under concentration methods, I want to take you through sedimentation techniques. These are not very expensive methods, and they are very cheap. The only thing you need to know is that you need a few of these reagents. Like you need to purchase some diethyl ether, or sometimes we call them ethyl acetate. If you are using Ritchie technique, then use the ethyl ether. But if you are using modified BFAS technique, then they say you use ethyl acetate, almost the same thing. You always need to prepare 10% formalin, or you can use 10% formalin actually. So when you make 10% formalin, it's formalin added to normal saline in ratio 1:9. And these other requirements down here is something you can have in your setups. So for a stool sample that's very formed, make sure that you take 1 gram. If it's semi-formed, you cut hapo, it's not formed, it's not watery, you use 1 to 2 grams. And if it's watery, then you make sure that you take 2 to 5 ml of the stool sample. This is what you require. So always know that in sedimentation techniques, we go for solutions of very, very low specific gravity so that we can allow oven cysts present in this stool sample to sediment at the bottom of the tube after centrifugation or after normal gravitational sedimentation. So this is the principle for formal either. It's always same for all sedimentation methods. Very many sedimentation methods, around 3 of them. The principle is the same. But formal either solution or whichever solution, formal detergent, formal either with formalin, I've got a very, very low specific gravity of less than 1.005. And therefore, this is what allows for over the cysts of parasites present to sediment at the bottom of the tube after centrifugation at a low speed. We always use a speed of between 1,000 and 1,500. But still, if you don't need a centrifuge in a setup, you want to do this experiment in the field, you can use formal detergent. We want to see the next procedure. Formal detergent uses the same principle. Formal detergent has a specific gravity or molecular weight of less than 1.005. So under normal gravitational forces, parasites are going to sediment at the bottom of the tube after some time. This is just a demonstration of how you have to separate your components in that tube. We have either which is less dense, then we have the debris, some fatty layer of stool comes up there, then formalin. You might have used 10% formalin or 10% formalin, comes the third one, then lower end there at the bottom, you have the sediment. So after an experiment, always disturb the debris so that you can pour the first 3 layers. You leave some small amount of formalin or 10% formalin to suspend your deposit. Put a fine drop on a slide, cover slip, and examine. So this is just the process. I've already explained the process. You mix 1 gram of a stool sample in 10% formalin or 10% formalin. After you mix, you strain. You can use around 10 ml to 12 ml of the solution. Then you strain using a gauze into a 15 ml tube. If you don't have a gauze, when we use a gauze, you use 4-layer gauze. Or you can use a filter paper in this tube. We normally filter to get rid of large particles in a stool sample, like food particles, etc. Then you can add some small amount of either and shake. You close your tube. Then you centrifuge at low speed, 1,000 to 1,500 RPM for 1 to 2 minutes. It forms the layers I showed you. Then you can disturb the debris and pour the first 3 layers, some small amount to suspend your deposit, put on a slide, cover slip, and examine. So a note to make, a direct wet prep is normally advised if you are expecting trophozoites in this stool sample, because formalin will kill these trophozoites. You will miss them. You will report false negatives. So what's the work of formalin in the experiment? 1, it preserves the parasites. Number 2, it breaks up some particles. Either dissolves fecal fats and also helps to clear the sample. Avoid high speed because it will distort some of the morphologies. The second one is formal detergent sedimentation method. The principle is the same. Formal detergent is actually twin 80. If you have come across twin 80, something sticky like glycerol, that's formal saline, formal detergent. So formal detergent is same, low specific gravity. Therefore, it's allowing for oven cyst to sediment at the bottom of the tube after some time. On this one, we don't centrifuge. So what you do, if you are suspecting schistosoma species or large fluids, those trematodes, you mix 10 ml of formal detergent with 1 to 2 grams of a stool sample. Then you filter into a tube and you stand for 1 hour. When you stand for 1 hour, after 1 hour, remove all the supernatant. If you are suspecting schistosoma or fluids, the trematode eggs, after 1 hour, remove the supernatant, discard, add another 10 ml of the same reagent. Then you stand for the second hour now, the next 1 hour. So the total is 2 hours. Then pour, remove your supernatant and pour away, examine the deposit or the sediment. If you are suspecting small over, after 1 hour, you remove your supernatant, you add 10 ml, then you leave it overnight. After overnight, this small over will hold the sediment at the bottom of the tube, and you examine them. You examine the deposit. This is our demonstrated. The far end here, we have cystosoma hematobium. We have that is from urine, but you might get it in stool sample due to contamination. We have cystosoma japonicum, number B. Number A, this is cystosoma mansoni. You can see the lateral spine. You can see the lateral knob, although not visible, it's inconspicuous. You cannot easily see it, but it's there. Then we have a terminal spine for cystosoma hematobium. The far end here, these are cystosoma intercalatum and hematobium, trying to show the differences. So on your far left, we have B and C. That B is cystosoma hematobium. Then number C is cystosoma intercalatum. Intercalatum is found in stool, hematobium in urine. But in a contamination situation, you can see all of them. How do you distinguish? Intercalatum is very elongated, long in size than in hematobium. Intercalatum has a very sharp spine, and this one for hematobium is blunt. Intercalatum has a curved spine. The spine is sharp and far end it's curved, which is very straight for hematobium. So this is just what I was explaining. After 1 hour for cystosomal trematodes, you pour the supernatant, add another one, you wait for 1 hour. For other parasites, you add 10 ml of the detergent, mix for 30 minutes, and you leave overnight. You can see number A, that is Ancylostoma duodenale, number B, that is Necata americana. So though you cannot easily distinguish them under a microscope, we're going to see how you can make a distinction between these two species. But number A is Ancylostoma duodenale, number B, that is Necata americana. Then we have fertilized and unfertilized ascaris. You can see fertilized is very long, big. Unfertilized is very long and big. Fertilized is somehow small. Fertilized has some, you see some developing embryo inside, which lacks in unfertilized. The outer shell of fertilized is very thick. The outer shell of unfertilized is very thin. And then this is Enterobius vermicularis, the other side, which has a flat side. One side is somehow flat, and you see a developing embryo inside. Of course, this is just an extension of the procedure. You can see on top there, we have a Tinea species. You cannot make a distinction between Tinea saginata and Tinea solium under microscopy. You need to do PCR. But you see they have striated membrane, thicker than this other Immunolepis nana and diminuta. It's striated. These other ones are very, very smooth. You can see the exact embryo inside, which has some 6-hooked oncosphere. And the difference, another difference between Hymenelepis diminuta and nana, you see diminuta is very big, nana is small, diminuta is very fine outside there, nana is somehow thick, and nana has some polar filaments. You can see some polar filaments there in that arrow, which lack in diminuta. So then these are demonstration of some trematode eggs. You can see Japonicum with a knob. You can see Mansoni with a lateral spine. You can see Hematobium with a terminal spine. You can see Clonotis sinensis up there, which is almost as heterophytes because all of them in that operculum, the lid-like structure up there, as we say, it has some shoulders in them. You see, it's like it has some shoulders where the operculum is settling. And down here we have Paragonmus westermani. It's smaller and it's very flattish on top than Fasciola hepatica and Fasciolopsis buski. And when you look at Paragonmus westermani, it's very thick. The outer layer, the shell is very thick than when you compare to Fasciola hepatica and Fasciolopsis buski. And it's small in size. The only difference between Fasciolopsis buski and hepatica is that buski is somehow big. This structure is just showing that the hepatica is big, but buski is the biggest trematode in terms of ova, and it lacks a knob. These are all other nematodes, trematodes have some knob, except for Fasciolopsis buski, which lacks some knob. Number 2, let's look briefly on flotation techniques. So I want to explain for you the principle of flotation techniques so that we can avoid going through the procedure. So when you choose flotation techniques, remember, for sedimentation methods, we choose salt solutions of, or we choose solutions of very low specific gravity. Now, when it comes to flotation methods, we want to examine floats. We want to float our parasites. We want to float our cysts. We want to float our ova. Always go for salt solutions of very, very high specific gravity, like 33% zinc sulfate, which has a specific gravity of 1.18, like 28% sodium chloride, or 33% magnesium sulfate, which have a specific gravity of 1.200, or you can choose 50 to 55% Shita solution, which has a specific gravity of 1.27. But remember, we have some ova that are very heavy. Like when you check on, if you want to float rhabdit from lavi, for example, of Strongyloides saccharides, it has a specific gravity of 1.30. So you cannot use flotation methods if you are doing studies on Strongyloides saccharides. If you are doing studies on Fasciola hepatica, Fasciolopsis buski, all schistosoma species, and majority of trematodes, you can't use these methods because those trematodes have got a specific gravity of 1.28. And you see, all these reactions here have got a maximum. The maximum one is Shita's sugar solution, which has 1.27. It means you'll miss the parasites. So when you are choosing a methodology in a study, always make sure that you know the type of parasites you are expecting or you are doing a study on so that you make the right choice. So this is a flotation method. So you prepare your reagent, you need a fresh sample. So for flotation, we don't use 1 to 2 grams. We use 2 to 3 grams, at least a large amount of stool sample. So what you do, you prepare N of these reagents. You emulsify your stool sample 2 to 3 grams using N of these reagents. Maybe you chose zinc sulfate, that's what you use to emulsify in a container. Then you filter into another tube using a filter paper or a gauze, 4-layer gauze. You top up to the beam. You put a cover slip on top. You just wait for 30 to 45 minutes. So these solutions have got a very high specific gravity of more than 1.27, for example, and this allows for an cyst present in a stool sample to float on the surface of the solution after some time due to the lower specific gravities. Actually, the specific gravity of these reagents is very high. It lowers the specific gravity of ova and cyst present to less than 1.008, so they become lighter. They float on the surface of the solution. They attach below the cover slip, and you can capture them when you examine under a microscope. So we encourage people to use sedimentation for majority of ova. Helminths have ova as their diagnostic stage. Protozoans have got oocyst, cyst when it comes to flotation methods. So these reagents are able to float cysts and oocysts easily than ova. So maybe for Enterobius vermicularis, Trichuris trichura, and somehow Ascaris, you might float or hookworm. But for trematodes, I can assure you can't use flotation method because they won't float. So this is just a demonstration of Cryptosporidium pavum oocyst, which has 4 sporozoids inside. This is an iodine prep, far end. On top, that is an iodine prep. So you've taken your floats, you add a drop of iodine, and you can see Cryptosporidium pavum. These are coccidian with some oocysts, which have sporozoids inside, 4 sporozoids inside. And down here, you can see we have a Zn from the same. You can still prepare Zn. So you can take a smear from your float, you air dry, and you do the Nelson technique, but you don't heat carbofucsin. The procedure is same as that one of Zell-Nelson for Mycobacterium tuberculosis, but here we don't heat carbofucsin. There we use hot carbofucsin. Here we are using cold carbofucsin. And so for Zn examination, this is how they appear like. On this other end, the brown one, you can see iodine prep for Isospora belli. It's also a coccidian, which has 1 sporocyst, or you can see this lower down here, which has 2 sporocysts. So it's sporulated. So when it's sporulated, we say it has more than 1. These are 2, and each sporocyst has 4 sporozoids inside. And on the lower end, number D, we have a Zn stain for Isospora belli. That's how they look like. So the process is simple, I've already explained. Emulsify your sample, filter, fill the tube to the beam, put a cover slip, stand for 30 to 45 minutes, remove your cover slip and examine. These are a repetition of zinc sulfate experiment. Let's look at quantification methods. So by estimating the parasite load in eggs, in terms of eggs per gram of stool, these techniques can, one, help us assess the intensity of infection, if it's light, moderate, or heavy. It also guides treatment decision, making treatment decisions or monitoring response to therapy. You can also use quantification methods for epidemiological studies to understand the disease burden in a population, especially the granular mapping. The recent granular mapping among primary school going children. You can also do this one for programs targeting deworming and parasite eradication, same as granular mapping. The first one is a cellophane thick smear technique, that's cathocards. It might be very expensive somehow, so I'm going to give you an alternative in the next slide. So, but this is what you need for cathocards technique. You are doing a study in the same. So you need a fresh sample, you need a card, a stiff card, or you can use a plastic sheet, aluminum foil template to support your sample. You need a cellophane strips that were pre-soaked in a glycerol malachite green solutions. For 24 hours, you need a forceps, spatula, etc. You need a template, cathocards template, which exactly measures for 1.7 milligrams of a stool sample. We're using this because we shall calculate the number over that we are seeing in our sample. That's why we are very specific in terms of this. Then we need slides and then a waste disposal bin. The principle says that a measured size of a stool sample is allowed to clear in glycerol and subsequently stain in malachite green for clear contrast and quantification. So you realize here, you take a glycerol and you mix with malachite green, then you soak some of your cellophane that you've cut in terms of 25 times 35 millimeters. So this is what you do. This is your stool sample. You transfer a small amount of feces into a piece of aluminum foil, or you can use a card, or you can use a paper, a nylon paper, newspaper, etc. Then you press using a spatula. So you put your sample on top of aluminum foil. You can use, you have several, you can use a stiff card, you can use plastic sheet, etc. Then you press using a spatula. So you take a template. You see, up here we have a template and we have a spatula, then we have a sieve. So you press the sieve on the feces by applying some force so that some feces will filter and come up. Those ones which have small particles. Then you scoop, you take a spatula, you take these finer feces and you fill a template. So you prepare two slides. You can prepare two slides with the same participant ID using a template, apply a stool onto the slider and gently remove the template. So when you remove the template, you cover that small portion. That small portion is equivalent to 41.7 grams. You cover using a cellophane that was pre-soaked in glycerol malachite green component. Then invert the slide and you put some pressure so that the stool can spread and make a thin preparation. Then you allow your glycerol to act for around 10 minutes. Then you read your slides using times 10, 10 times 40. So this is the process. We always say that for hookworm, we read within 30 minutes. For other species, you can live for even 1 hour. Because we say you leave the slide for 30 to 60 minutes. Hookworm, glycerol clears hookworm very fast. Hookworm has a very tiny shell, so it clears and the morphology will be distorted. You'll miss to see the parasite. So if you are suspecting hookworm or your research is very specific on hookworm, or your examination in general is very specific for hookworm, make sure you read within 30 minutes. Then you can examine, then you count the eggs by multiplying by 24. So 24, these are how you get your 24. It's 1,000. So you see, 41.7 milligrams, 1 gram equals to 1,000 milligrams. And we have picked 41.7 milligrams. So we want to get the stool sample in 1 gram. So it's 41.7 that we use. The parasites, the the eggs we count in 41.7 times 24. So 1,000 over 41.7 equals to 24. So it's 41.7 times 24 now here to get the total number of eggs per gram, eggs per gram. Note, glycerol dehydrates and clears delicate cysts. Therefore, this method might not be ideal for trovozoites, or for cysts, sorry, that's from protozoan parasites. So remember, we might expect to see some protozoans here, cysts from protozoans, but this method is not ideal if you are doing a study on protozoans, like Endomyba histolytica, G. lambda, Balantidium coli. So, because this glycerol is going to dehydrate and clear their delicate cysts. The second one that we might do in our setups is Stool's egg counting technique. So when I measure the quantity of stool is related with a known volume of potassium hydroxide, 0.1 normality sodium hydroxide, a small measured alquot can be examined and then number of eggs calculated using an addition factor. So this is what we need. We need a fresh stool sample, 0.1 normality sodium hydroxide, normal saline, cylinders, pipettes, microscope slides, weight balance, etc. So you weigh 0.1 gram. If you don't have weight balance, you can measure the size of a matchstick tip. That size of a matchstick tip is equivalent to 0.1 grams. And you standardize that, you standardize your method like that. Then you dilute this in 10 ml of 0.1 normality sodium hydroxide or saline. This gives you a ratio of 1 to 100. You mix uniformly, then you pipette exactly 0.15 ml of this suspension to put on a slide to cover slip and examine. Then we count the eggs in the entire area under a microscope. So we are forced to multiply by 100 to obtain eggs per gram. Because remember, we used 0.1 gram of a stool sample, but our dilution factor was 1 to 1,000, 1 to 100, sorry, because it's 0.1 over 10, which gives you 100. So our ratio is 1 to 100. So 0.1 gram was in 10. So because this is 10 ml that we've used and we picked 0.15, so the dilution factor is what we use to multiply and get the eggs per gram of a stool sample. So that is why we are using 100 as our multiplying factor. Limitations, this is less sensitive for light infections, and it might not distinguish species unless the eggs are morphologically distinct. It's also not suitable for protozoan parasites. We have stool culture techniques. So stool culture techniques, certain parasites like larvae and trovozoites can be cultured. Where do we culture some of these parasites? We culture to enhance species identification, especially Strongyloides stachylaris from hookworm, or to distinguish Endomyba histolytica from other Endomyba species. It also increases diagnostic sensitivity. It also helps to differentiate morphologically similar species, e.g. histolytica and dispar. So when you're doing cultures, for example, for Endomyba species, we can use xenic culture techniques or azenic. Azenic is where you don't use a bacterium. For xenic, we are using a bacterium like E. coli to assist for nutrients for this parasite. But for azenic, we are using completely a sterile technique whereby we don't include a bacterium. So for you to make a distinction between the two, then you need to do culture. It also supports research, drug testing, and pathogenicity studies. So the first one is a modified Bayern technique. This is for Strongyloides stachylaris, although sometimes you might see some of larvae forms of hookworm. So the principle says when suspended in warm water, motile larvae move away from fecal material placed on amorphous medium like gauze or filter paper by migrating down and collecting at the bottom of a funnel due to gravity. Then the liquid can be examined microscopically for larvae. So what you do here, you arrange your apparatus in this stand like this. You are sewing or a fecal material mixed in a gauze or a filter paper. Then you have a wire screen there to get rid of large particles. You have some water, which is at around 37 to 40 degrees Celsius. So, and a rubber tubing and a clamp so that you can hold your sediments before examination. Then is a container to collect your sediments when you unclamp this rubber tubing. So requirements are just like this. This is requirements. Then the procedure says you set up your apparatus, you clamp the rubber tubing attached to a funnel, and you fill your funnel with some warm water, like in this experiment. Then you place some 5 grams of stool on a gauze or a filter paper or a tissue paper and tie it like a pouch. You suspend it so that it does not touch the water. It does not float. It touches the water, but it does not float actually. So that the parasites or the stool sample is intact with the water. You incubate for around 12 to 24 hours. Then larvae will migrate out of the stool sample through the gauze and settle at the tip of the funnel. So after some incubation, you gently release a few drops of the tubing by releasing the clamp. Then you put some of the drops on a microscope slide, cover slip, and examine. So you can examine. This one is specifically for Strongyloides staphylococcus, but sometimes you might get some old stool sample. A stool sample has stayed for around 1 hour in a lab without being tested. So then Ocom eggs can hatch to rhabditiform larvae. So this is how you can distinguish between a rhabditiform larvae of Staphylococcus and hookworm by looking at their mouth parts, the esophagus, and that genital perimordium. You can also make a distinction of platform larvae by looking at the esophagus and the junction between the esophagus and the intestines of the larvae forms. The limitation is that this technique is not suitable for identifying non-motile stages like eggs and cysts. It requires fresh tool, cannot quantify burden. It may fail if some larvae were very few or inactive in that stool sample. These are difference between Staphylococcus larvae and hookworm larvae. Staphylococcus has shallow mouth parts, buccal cavity, hookworm deep buccal cavity. The mouth parts for Staphylococcus are very short and long for hookworm. Staphylococcus is not sheeted. Hookworm is always sheeted, especially the filariform larvae. Hookworm larvae has a pointed tail. Staphylococcus has a notched, pointed but notched, curved down there. Staphylococcus has a prominent genital perimordium which lags in hookworm. This is also a further explanation of the pictograms. We'll share the slides, you'll have a look at them. The second culture method is Aradamori. This is for hookworm, although we might capture some Strongyloides from this method, as much as it's very specific for hookworm. So that's why we need to make the distinction between the two, Staphylococcus and hookworm. So here, a stool containing eggs of hookworm species is smeared in a moist filter paper and kept in a test tube with water. These eggs hatch into larvae due to warmth and moisture. The larvae migrate into water and collect at the bottom of the tube and then examine for species. So this one, we said for eggs, we might not distinguish between Ancylostoma duodenal and Necata americanus. For species identification, we need to culture the eggs so that they hatch into larvae so that we can distinguish the two species. So that the requirements. So you spread your feces on a strip of filter paper, which is soaked in water. You place the filter paper in a container, that's 7 ml tube that has 7 ml distilled water. You seal with using a cellophane or a rubber band. You incubate at room temperature. 25 to 30 is room temperature. This is temperature in the soil. So we want to assume that they are in the soil and they are hatching. So here we are hatching. Remember, we are hatching and we are expecting to see from larvae, the infective stage, not a rhabditiform larvae. So for Behrman technique here, we are culturing rhabditiform larvae, but for Aradamori, for hookworm, we are hatching from larvae. So after some time, you can kill these larvae forms by submerging in 50 degrees Celsius of water. Remember, they are very infective. They can pierce through your skin. They are very active, sharp, very motile, and they have some enzymatic actions that you can pierce through your skin and cause infection. So you have to kill them by submerging 50 degrees water. You remove the filter paper, you discard, you transfer your fluid into a tube, you centrifuge at 1000 Gs for 2 to 3 minutes. Remember 1 G, we said 1 G equals to 1.6 revolutions per minute. So you can convert this if you want to get RPM. Then you examine the sediment times 10 times 40. This is just a simple explanation of the process. And this is the difference between Ancylostoma duodenal larva and Necata americanus. Ancylostoma head and tail blunt. Necata americanus head and tail very pointed. Ancylostoma, there is no gap between the esophagus and the intestines. And we always see a gap between the esophagus and the intestines for the larvae of Necata americanus. And the esophagus does not end in a tarsal funnel shape in Ancylostoma duodenal, but for americanus, the esophagus ends in a tarsal funnel shape. We're going to see. This is what I mean. This structure here, it behaves like a funnel. This is the junction between the esophagus and the intestine, sorry. And this is Americana stop there. You can see this is Necata Americanus, this is ancylostoma duodenale. So you can see the mouth parts. This is very sharp. Necata Americanus, the tail here and the mouth part is sharp. This one is blunt here. You can see the funnel-like structure where my arrow is, the cursor. It behaves like a funnel. This is the junction between the esophagus here and the intestines here. It's like a funnel, and there is a space, there is a gap here between the esophagus and the intestines. This is a further explanation between rubriform larvae and flatform larvae. You can always see that one. We look at the size, look at the buccal cavity, we look at the genital perimordium, the tail, and the body wall. Remember, rubriform larvae, for example, are for diagnostic stage, and flatform larvae is the infective stage. So it's tiny, long, very sharp, and very, very motile because it's the infective stage. Let's briefly look at artifacts and confusions that we might see in stool and you confuse like parasites. So you might see white blood cells like eosinophils, and you confuse, you think that is a cyst of Endamypa histolytica or Endamypa species from a stained examination of, like, for example, from trichrome staining. You can stain permanent slides and examine under times 100, and you confuse them. You can see budding yeast, starch cells, fungal elements, and you confuse with Endamypa histolytica and all Endamypa species. You might see epithelial cells under a stained examination, and you think that's Endamypa histolytica trophozoite. You might see pollen grains, and you think that is Tinea species. So you must always master the internal structures of these stages, because always when you add, for example, iodine, you are able to study the internal structures of these stages, and you cannot then confuse them with these lookalikes. Ascaris lumbricoids, both fertilized and fertilized, they look like fatty globules or vegetable cells. We have hookworm and Strongyloides larvae. They look like vegetable spirals or plant air if there was some contamination. Then there is this important feature that we normally see, the charcoal-laden crystals in stool or in sputum samples. These are very significant. When you see these ones, then these are as a result of, or these are products of eosinophil breakdown. Remember, we have some parasites that undergo heart-lung migration, like Strongyloides, Stachylaris, Ascaris, and hookworm species. Anytime they undergo heart-lung migration, the body responds by producing a lot of eosinophils. So when they produce a lot of eosinophils, it can come as an allergic-like reaction. Someone coughs, they cough, they are coughing this, the larvae form of these organisms, these parasites, then they swallow them, then the life cycle starts from there. So during that coughing, the body produces a lot of eosinophils, and the eosinophils can break in form of mast cells, and release some contents like histamine, serotonin, prostaglandin, which make someone to sneeze, have some running nose. This is an allergic reaction. You think it's an allergic reaction from maybe pollen grains or a perfume, etc. It's an allergic reaction due to heart-lung migration. So when you see this, then it means an immune reaction has taken place. Especially eosinophils have been produced in large numbers, and they are broken down to counter the reaction. So you have to report these crystals when you see them in stool or sputum sample. So this is an example of confusers. I'm almost finishing. So you might see mite eggs, and you think they are hookworm eggs. You see, they are almost resembling. You might see seeds from intestinal biopsy. You think you're seeing Palantidium coli. You see, this is behaving like a macronucleus. This one is a macro or micronucleus. You might see mushroom spores. Look at this one, almost like Enterobius vermicularis. You might see bee sprouts similar as Enterobius vermicularis adult worms. You might see earthworms, and you think you are seeing Ascaris lumbricoids. Look at this one here on far end. Imagine this one is Endamypa histolytica and a white cell. This is a white cell. It's almost like Endamypa histolytica. The only difference is it has two nucleus inside. These are like an eosinophil or a neutrophil with a shift to the left. It's almost looking like this, almost confusing people. And sometimes Hatimani might have, and the Hatimani might have two nucleus, so it will confuse you. Make sure you study some other internal structures of this parasite so that you can make a distinction. Look at these pollen grains, like tiny species. Look at these vegetable cells here. They exactly look like ascaris. Look at these vegetable spirals. You can think it's a helminth larvae, or you can think it's a segment from tapeworms. We said these ones we have to report, these charcoal-laden crystals. Look at the yeast cells. Well, it can confuse you, think these are Timani, in the Maiba Timani. Look at this plant air. It looks like a larvae form. So other methods that you can use to culture, as I finish, is you can do charcoal culture for culturing from larvae of Strongyloides staphylococcus. Here we use activated charcoal powder that's commercially available for lab diagnosis. You can do agar plate to see migration of this from larvae of Strongyloides staphylococcus as they migrate along this agar. You can do xenic or azenic. We said you can culture trovozoites of histolytic and G. lambda using xenic, where we introduce a bacterium known as Escherichia coli to provide nutrients for this, because these are bacterium are along our gut, and these organisms always stay in our alimentary canal, so they can get nutrients from the bacteria. Or sometimes you can get rid of this bacterium and do a very sterile culture specifically for Entamoeba histolytica when you want to do molecular studies for research and vaccine development. You can do egg hatching and viability test for schistosoma species. That is for diagnostic viability assessment or infectivity test, etc. Other methods include you can do RDTs. We have RDTs which can check for histolytica, G. lambda, and Cryptosporidium parvum, which are 3-in-1. They check for the antigen, or you can do, of course, real-time PCR to check for the nucleic acid of these parasites. All these are very sensitive and very specific, and they can help us during low load or in asymptomatic cases. You can also prepare permanent slides like glycerol alcohol method, trichome staining for these. You can do acridine orange staining technique when you want to examine chromatoid bodies for Entamoeba species. You can do ion hematoxylin for protozoans. You can do modified Zn staining for coccidians, like what I showed you for Cryptosporidium parvum and Isospora belli. Take home points. So microscopy remains the cornerstone when combined with both direct and concentration methods. That means accurate diagnosis is always ensured by proper stool collection, knowledge of parasite morphology, recognition of the various stages, including trovozoites, eggs, larvae, and cysts. Prevent misdiagnosis with routine QC and staining. Always do some QCs, my colleagues. For tracking worm burden and therapy, always use quantification methods like cattle cards and stores method. Clear, timely reports that direct clinical care are very essential. For sensitivity and specificity, we said use antigen testing methods or use PCR. And then lab officers are the first line of defense for public health and parasite control. So I want to pose some questions to you just for food for your thought. You don't need to answer. So I want to ask you, colleagues, if we have better tools within our reach, then what's stopping us from using them? If we can have some of these tools within our reach, why can't we do these concentration methods? So what legacy will we leave as lab professionals if we continue doing things the same way despite knowing better? You've gone to school, you know you can do these methods. You've been taught in CMEs, you know you can do these methods better, but you always dwell on a direct method. And lastly, can we truly achieve our universal health coverage if the foundation of accurate diagnosis is still shaky? So colleagues, we can do more than a direct method. I encourage you to talk to your supervisors, to your heads of departments, that you can introduce at least flotation and sedimentation methods when it comes to stool parasite diagnosis. Thank you.
Thank you so much, Mr. Hosea. This was wonderful. We have learned a lot today, and I believe many of us are going to have something, skill that they're going to take home. They're going to have a knowledge that they're going to try and apply in their workplaces. Time has really gone. We are um, 8 minute short our end time for this webinar, but allow me to maybe look at the Q&A section, and maybe you're going to help us answer some questions. No, there's a question from Ngeno Peter, and here it goes. How do the sensitivity and specificity of traditional microscopy compared to our molecular diagnostic methods like PCR in detecting intestinal parasites in stool samples? And what are the challenges and benefits of implementing molecular diagnostics in routine laboratory settings, especially in resource-limited environments? Over to you, Hosea.
So again, this is my answer. When it comes to specificity and sensitivity, PCR is 99.9% specific and sensitive than microscopy. Remember, microscopy, one, depends on the skills and the experience of the microscopists. Number two, remember, we have some situations whereby we can have very few parasites in a stool sample and we can easily miss to see them under microscopy. But when you extract a nucleic material of an organism or a parasite, even the smallest numbers are going to be multiplied and amplified in that sequence, and you'll see several of them, and of course, we can't miss them. Nowadays, we have portable PCR machines. They are very small ones. Like I'm sure you've seen those ones that have replaced the Gene Expert for tuberculosis, but still it's a challenge for rural healthcare facilities. But I can assure you, if you refer a sample, if you are doubtful on a sample and the results are not clear, always refer a sample. Don't leave the patients die because we are unable to diagnose an UCOM infection and they die of anemia. Yet you could be able to refer a sample to, for example, Camry for PCR testing and you get correct results. Thank you.
Thank you. Another question from Anonymous, and he is asking, kindly repeat again length of time one slide should be examined.
We examine a slide for between 10 and 30 minutes. The WHO has not exactly defined how long we should examine a smear. So I expect in your health setups, in your sub-county, county hospitals, your research labs, you set up your turnaround time and you come up with a time limit for examining a slide. But remember, if you delay examining a slide for above 30 minutes, it will dry up. So it's better you examine between 10 and 20 minutes before it dries. But make sure you examine it thoroughly so that you go through all the fields that you don't miss a diagnosis.
Thank you. Willie Kipkenei, how do we use 10% formalin to preserve stool?
So 10% formalin is normally formalin comes in 40% concentration. So when you want to make 10%, remember you require 10%. It depends on the volume you want. For example, you want 20 ml. So it's 10 times 20 over the original. It comes in 39 to 40%. That is 10 times 20 over 40. So that's 200 over 40. So you get 5. So you are going to take 5 ml of formalin and top up to 20 using distilled water. Or sometimes people prefer you can use normal saline. So you could have come up with 10% formalin. Remember, if you under dilute, it means you are going to distort the morphology of whatever you want to stock. Or if you over dilute, you are going to lyse whatever you wanted to preserve. You'll miss them. You think you preserve. In future, when you are looking for your specimens, you lack the parasites. So make sure you do the right percentage, the right ratio.
Thank you. Just per Olum, our normal bench microscopes do not show distinct bodies like anema and the rest of identities. Is there any difference in motility between G. lamblia and the plasma?
Ada, I missed your question, Ada.
Yes, a question from Jasper Olum, and he is saying,
yes.
Our normal bench microscopes do not show distinct bodies like axonema, nuclei, and the rest of identities.
Yes.
Is there any difference in motility between lamblia and Flagella1? Yes.
So lamblia, the motility for lamblia is just like a falling leaf. when you are examining, when you are looking at the movement for G. lamblia, it's like a falling leaf. Unlike these other ones, like for example, for hominids, it's jerky, it's very fast. For trovozoids of entamoeba stolytic, it's directional. It's moving using acid in a directional manner, very fast but directional. So for you to see cilia or flagella, we encourage you use 0.5% eosin. You can add eosin. Eosin 0.5%, 0.1 to 0.5% eosin does not kill. It won't kill the trovozoids. So when you add eosin colors the background, it does not color the parasites. It colors the background so that it can leave the parasites unstained. Then you can make a distinction. Then you can check and you realize histolytica is using a pseudopodium in a directional manner. G. lambda is behaving like a falling leaf, but it has flagella. You can actually now see the flagella. And for example, this other one, Palantidium cola is using cilia. But before you add eosin, sorry, you might not see the locomotive organelles. So make sure you can improvise. You can buy 0.1 to 0.5% eosin so that you can make a distinction between the locomotive organelles for this one. And not the microscope can see, you can see this one, see if you add eosin. Thank you.
Thank you. Another question. Let's look at. There is Harrison Jeru, and he is asking: is it significant to report yeast cells in stool analysis under microscope? Maybe you can guide us, Mr. Hosea, on that.
So remember we said you might confuse things like yeast cells if you are doing a stain preparation and you confuse with parasites. But now it depends if the specimen was not contaminated, then it might not be helpful to report yeast cells because we consider them contaminants. And we want to assume it was not contaminated with urine. That's why we always insist that make sure you confirm it was not contaminated because it might be a result of contamination from urine, which should be reported actually if it was in urine. It's very significant. But assuming this specimen was not contaminated, we assume that these yeast cells are just contaminants. Thank you.
Thank you, Mr. Hosea. Now, our last is Robert Coz. And
I lost you, Ada.
watch.
Ada, I lost you.
You're not here.
Yes, I'm not getting you, Ada. Kindly repeat.
Are you able to hear me now?
Yes.
Okay, there's our last question from, not a question, but a statement from Robert
Yes.
Kroos. And he is saying,
Yes.
he doesn't have a question, but a
Yes.
word of appreciation for the well presentation you've given to us today. So
Thank you
he's
very
saying
much.
thumbs up, Doc.
Thank you very
We've
much.
come to an end. We've just come to an end of our presentation because of time. And so, Mr. Hosea, maybe you'll take 1 minute to do your parting shot. Then I conclude. Then I'll come in to conclude. Welcome once again.
Okay. Now, as lab officers, I want to challenge you on this. Accurate stool parasite diagnosis is not just a laboratory task. Remember, it's a public health responsibility. Therefore, colleagues, let's stay informed. Let's continue being champions of quality diagnosis because it's through quality diagnosis that we can make the right decision when it comes to patient care and treatment of these parasitic infections. And of course, generally, this is good for public health in our community. Thank you.
Yes, thank you so much. We've really appreciated this presentation today. It was so comprehensive and very vast in terms of skills and knowledge. Dear participants, we've come to the end of this presentation. I hope I'll be able to see you again on our next webinar. And on behalf of Lab Medicine Society of Kenya, we want to appreciate you as the participants for always ensuring that you attend our webinars. We also want to appreciate our presenter today, Mr. Hosea, who has done a great job. and I hope he will be able to do this again in another time if scheduled as well. To our members, our participants can as well access Hosea through us. If you have any question to Hosea, you can always access Hosea through us, and we'll be able to connect you. Allow me to end this session and see you again in our next webinar. Otherwise, thank you so much. My name is Arthur Imari, and have a good evening.